Signs and symptoms of common illnesses. These are the areas that this training will cover: abdominal pain, sleep apnea and snoring, allergic reactions, bowel obstruction, constipation, a number of antibiotic-resistant bacteria, Clostridium difficile or C. diff, dehydration, diarrhea, dysphagia and aspiration, falls, somebody who's just not right, PICA, sepsis, seizures and epilepsy, pressure ulcers. Abdominal pain or a bellyache. Our stomach extends from below our chest to our groin area. Some people call it the stomach. Our abdomen contains many other important organs, including the stomach, small and large intestines, pancreas, liver, gallbladder, kidneys, and spleen. Pain in the abdomen can come from any one of them. The pain may start somewhere else, such as our chest. Other considerations when someone has abdominal pain: has a person had this before? How bad is the pain? Could it be constipation? Where is the pain? What is the pain like? Is it related to food? Are there any other symptoms? Examples of common abdominal pain and causes. You could have the stomach flu, which is abdominal pain, diarrhea, and stomach cramps. You can have ovulation pain, which is a lower belly pain, pelvic pain, and cramping, or gastritis, abdominal pain, vomiting, and a burning chest pain. In these cases, it's always good to consult with the PCP. It's better safe than sorry. Seek urgent care or emergency care. Call 911 if the individual appears very ill, symptoms develop very suddenly and significant enough to stop normal activity, such as abdominal pain that is very sharp and severe, pain in the chest, neck, or shoulder. Abdomen is stiff, hard, and tender to touch, difficulty breathing, or having an irregular heartbeat. This chart shows the anatomy of the abdomen. Sleep apnea and snoring. What is snoring? Snoring is harsh or hoarse sounds from nose or mouth that occur when breathing is partially obstructed while sleeping. Snoring is often associated with a sleep disorder called obstructive sleep apnea, or OSA. OSA is the narrowing of the throat and airway that can potentially contribute to serious sleep disorders in which breathing stops and starts. Snoring can have causes that are not due to underlying disease. For example, anatomic variation of the nose and soft palate, alcohol consumption, and nasal congestion can also cause sleep apnea and snoring. There are some risks for sleep apnea, including someone being a little bit overweight, thicker neck circumference, elderly people, after menopause, and folks that have a narrowed airway, large tonsils or adenoids, being male, 2 to 3 times more likely to have sleep apnea, and a family history of sleep apnea. Is there any treatment for sleep apnea? Yes. You can reduce the risk factors, and you can use a CPAP, or continuous positive airway pressure machine. What are the signs and symptoms of sleep apnea? Loud snoring, episodes of stopped breathing during sleeping, waking up with a dry mouth, difficulty staying asleep, excessive daytime sleepiness, and irritability. Complications from sleep apnea: daytime fatigue, hypertension, heart problems, increased risk of irregular heartbeat, diabetes type 2, metabolic syndrome, hypertension, hyperglycemia, and excess weight, and liver problems. There are 3 types of sleep apnea. The first is obstructive sleep apnea, the more common form that occurs when throat muscles relax. Number 2 is central sleep apnea. It occurs when our brain does not send proper signals to the muscles that control breathing: the diaphragm, intercostal muscle, the muscles in the neck and abdominal muscles. And the third is complex sleep apnea syndrome. Occurs when an individual has both OSA and CSA. This chart shows the continuous positive airway pressure, or CPAP machine, and various masks that can be used with it. These charts show the lung and chest area and what happens when we breathe in and breathe out. Allergic reactions. What are allergic reactions? They're a condition in which the immune system reacts abnormally to a foreign substance or material. That material is called an allergen. What are some examples of common allergens? Pollen, dust mites, dust, animal dandruff, food, bee stings. And how can they affect us? It depends on the way your body reacts and how much allergen gets into our system. In some cases, people can go into anaphylaxis or anaphylactic reaction, which is the most dangerous type of allergic reaction. It is severe and possibly life-threatening. It can occur within seconds or minutes after exposure. What are the most common signs of anaphylactic shock? They are difficulty breathing, the throat is closing up, severe wheezing, swelling of the face, tongue, eyes, or at the affected area or site of an insect bite, for example, dizziness, and a gray-blue color. What should we do if we see an allergic reaction with signs of anaphylactic shock? Call 911 right away. For other situations, consult with a healthcare practitioner. Write down what you see and what you think may be the cause, and share it with your PCP or other healthcare provider. How to prevent allergic reactions? Avoid your allergens. Take medications as prescribed. Keep epinephrine auto-injectors with you all the time if you are at risk for anaphylaxis. Bowel obstruction. Not a pretty picture to see. Bowel obstruction can be an extremely dangerous situation. What are some of the risk factors? Abdominal surgery, a cancer or tumor, congenital abnormalities, poor dietary habits, lack of exercise, and constipation. What are the symptoms of bowel obstructions? Constipation, lack of an appetite, stomach cramps that come and go, abdominal distension, vomiting, and really being bloated, not being able to pass gas. How can we prevent it? Know the person's medical history, consume adequate fluids, monitor bowel movements, consult with a healthcare practitioner, eat a healthy, balanced diet, and exercise. It is important to notify the person's healthcare practitioner if you believe somebody may have a bowel obstruction. If it's serious, call 911. An X-ray is needed to identify the level of obstruction and its cause, and then the plan for treatment. Care providers need to provide accurate, timely information to healthcare practitioners in order to assure prompt and effective intervention. Constipation. What is constipation? It refers to bowel movements that are infrequent or hard to pass. A bowel movement should be soft, formed, and it should not hurt or cause bleeding. What are symptoms of constipation? Fewer than usual bowel movements. Stools are hard and dry, increased gas, stomach pain or tenderness, and small liquid stool that is leaking. Call 911 if the person is gravely ill, gray in color, in severe pain, or has large amounts of blood in their stools. What causes constipation? Lack of fluid intake, not eating enough fiber, and not getting enough physical activity. Health conditions also can cause constipation, So health conditions that affect a person's metabolism, such as diabetes, damage the nerve controlling the digestive system, affect one's brain, such as Parkinson's disease, occur due to improper functioning of the automatic nervous system, affect hormonal systems, such as hypothyroidism, as it slows the action of the digestive tract, side effects of drugs, especially antipsychotic medication, muscle relaxants, and pain medications, and anatomic problems in a person's digestive tract. Antibiotic-resistant bacteria. What are antibiotic-resistant bacteria? They are bacteria that have become resistant to certain antibiotics. Who gets it? An infection from one of these bacteria usually happens to people who are in the hospital, who are elderly, and or very sick. Healthy people rarely get these types of infections. Can it spread? Yes, to people who are sick or have weak immune systems especially. Is it treatable? Yes. Some antibiotics can still successfully cure the infections. What's the difference between colonization and infection? Colonization means that the bacteria is in or on the person's body, but it is not making them sick. Colonization may not be treated at all. Infection, that the bacteria are present in or on a person's body and it's making them sick. It is important to use universal precautions. It will prevent the spread of this condition. What do? We call 911 if the person looks very sick, won't wake up, has chills or is shaking, is confused or disoriented, has low blood pressure, has decreased urine output, has a high fever, very warm body temperature, and is experiencing an elevated heart rate. Clostridium difficile, or C. diff. What is C. diff? It is a type of bacteria that lives in many people's intestines. It also lives in the environment, such as in soil, water, and animal feces. C. diff is part of the normal balance of bacteria in your body. Most people never have a problem with C. diff. If there is an imbalance in your intestines, C. diff may begin to grow out of control, however. The bacteria start to release toxins that attack the lining of your intestines. This is what leads to symptoms of a C. diff infection. Symptoms of a C. diff infection can range from mild to severe. Mild symptoms can include watery diarrhea 3 or more times a day for several days, stomach pain, or stomach tenderness. Severe symptoms can include frequent watery diarrhea up to 15 times a day, severe stomach pain and tenderness, nausea, loss of appetite, a low-grade fever of up to 101 degrees in children or 100 degrees to 102 in adults, blood or pus in your stool. C. diff bacteria are contagious. They can spread from person to person. They also live a long time on surfaces such as toilet seats, telephones, and doorknobs. Good hygiene can help to avoid the bacteria. The most common way of it spreading is on the hands of caregivers. What are the serious complications of this disease? Dehydration, severely low blood pressure, kidney failure, bowel perforation, or toxic megacolon. What causes a C. diff infection? It's associated with healthcare and recent antibiotic use and medication to reduce acid. Is it treatable? Of course, yes. How is C. diff diagnosed? It's diagnosed with a stool test or an X-ray or CAT scan of the colon. What are the risk factors? Person being elderly, a person who has overused antibiotics, or somebody who's been in the hospital. Can a C. diff infection be prevented or avoided? Yes. It can be done so with good hygiene, standard precautions, and chlorine-based cleaning products. Dehydration. Dehydration is a harmful reduction in the amount of water in the body. We can have mild, moderate, or severe dehydration. Causes: not drinking enough or not eating enough, fever, diarrhea, vomiting, excessive sweating, illnesses, infections, hot weather, and side effects of some medications. Signs and symptoms of dehydration. These include dry skin, cracked lips, less urinating, a dark yellow urine, dizziness, rapid breathing, irritability, and sleepiness. What should you do? Stay hydrated by drinking clear fluids. Address the other conditions that can cause dehydration as well. Diarrhea. Definition of diarrhea is loose, watery bowel movement that may occur frequently and with a sense of urgency. There are many causes of diarrhea that include food intolerance or an allergy to certain foods, stress, anxiety, use of a laxative, infections, overeating high-fiber foods, some medications, diseases of the intestine, hyperthyroidism, which can increase intestinal mobility, and the lining of the intestine may secrete more fluids. Symptoms: watery bowel movements 2 to 3 times in a short period of time, cramps or tenderness in the abdomen, increased gas, a decrease in appetite, and the stool may have a bad odor, unusual color, and irritation in the rectal area. Dysphagia and aspiration. What is dysphagia? Dysphagia is difficulty swallowing foods or liquids arising from throat or esophagus, ranging from mild difficulty to complete and painful blockage. What is aspiration? It's a condition in which foods, liquids, saliva, or vomit is breathed into the airways or lungs. Signs and symptoms: pain while swallowing, choking, feeling like something is stuck in your throat or chest, being hoarse, coughing up food, gagging or coughing when swallowing, bad breath, drooling, and weight loss. Frequent heartburn, dehydration, inhaling food, aspiration, which can lead to lung infections such as pneumonia. This chart shows the parts of the mouth and neck involved in swallowing. Falls. What should you do? Falling is the second leading cause of accidental death worldwide. It is a major cause of personal injury, especially for the elderly. Falls can happen for many reasons: seizures, body or physical deformities, an imbalanced gait, medication, poor vision, even tiredness. What to look for? Signs of injuries, complaints of pain or discomfort from the person. Call 911 if the person is still in a lot of pain while still lying, still in a lot of pain when they move, has an obvious deformity, is unconscious, gray in color, or is bleeding. A person who's just not right. When you notice someone is just not right, it may be helpful to think about describing your observations by comparing them to how the individual usually behaves or appears. When you look at the person or think about what you are seeing, what is different from what you usually see? Call 911 if the change is very sudden, the person looks very ill, or the person won't wake up. What to compare? What to look at? Look at their face. How are they moving? Is there any change in their voice? Any elevated body temperature? How is their breathing? Has there been any new medications introduced to the person? Have there been significant changes in the person's life? Death or illnesses in their family, for example? Have there been any changes in bowel or bladder habits? Have there been any changes in their ability or desire to participate in activities? Has their appetite changed? Has there been any changes in sleeping? PICA. PICA is an eating disorder demonstrated by craving and chewing substances that have no nutritional value and are non-food substances. For example, clay, paper, soil, etc. It may be an indication in some circumstances of a nutritional deficiency, for example, iron. Before making a diagnosis of PICA, the healthcare practitioner will evaluate for the presence of other disorders, such as intellectual disabilities, developmental disabilities, obsessive-compulsive disabilities. In addition, they'll collaborate with the mental health team to develop a treatment plan. What are the risks of PICA? Poisoning, infection or parasitic diseases, and gastrointestinal problems. What should we do if we work with someone with PICA? Follow any specific protocols that are in place, provide training of the protocol, and review the protocol at regular intervals to make sure it is still working and is effective. Sepsis. Sepsis is a potentially life-threatening complication from an infection. It is caused by infection in the bloodstream by toxin-producing bacteria. The goal is to treat sepsis during its early stage. Sepsis can be caused by an untreated bacterial infection or one that is not responding to treatment. The infection can occur in all human organs. Bacterial, viral, fungal infections can lead into sepsis. Most often, sepsis occurs in people who are hospitalized. We should know the early signs of sepsis. They are a reduced mental alertness, hyperventilation, fever as little as 2 degrees higher than normal. Among adults, the average body temperature ranges from 97 to 99, so it'll be a little bit higher than that. The healthcare practitioner will diagnose a person with sepsis if a person exhibits at least 2 of the below, plus a probable or confirmed infection, that there is an elevated body temperature, that the heart rate is higher than 90 beats a minute, and the respiratory rate is higher than 20 breaths a minute. Advanced signs of sepsis: significantly decreased urine output, a very high fever, chills, shaking, or a very low temperature, abrupt mental changes such as confusion or delirium, a rapid heart rate of greater than 90 beats per minute, difficulty breathing, low blood pressure, and other signs that could occur can be abdominal pain, nausea, or vomiting. Note, sepsis can also cause blood clots. What are the risk factors? Any infections, people with chronic serious illnesses and/or impaired immune systems, seizures, or epilepsy. Seizures or epilepsy is a sudden surge of electrical activity in the brain. It can cause a misfire and result in convulsions or the seizure. Remember, seizures are not a disease in themselves. They are a symptom of many different disorders that can affect the brain. Some seizures can hardly be noticed, while others are totally disabling. The nature of seizures varies because of the lobes of the brain controlling different behaviors, movements, and experience. The frontal lobe, the most anterior lobe right under the forehead, the frontal lobe controls intellectual activities, such as the ability to organize, as well as personality, behavior, and emotional control. The parietal lobe is located near the back and top of the head above the ears, and the parietal lobe controls the ability to read, write, and understand spatial relationships. The occipital lobe is the most posterior lobe at the back of the head. The occipital lobe controls sight. Temporal lobe is on the side of the head above the ears, situated immediately behind and below the frontal lobes. The temporal lobe controls memory, speech, and comprehension. The nature of seizures varies because of the lobes of the brain controlling different behaviors, movements, and experiences. The brainstem, the lower part of the brain that leads to the spinal cord, the brainstem contains nerve fibers that carry signals to and from all parts of the body. The brainstem also regulates bodily functions such as consciousness, fatigue, heart rate, and blood pressure. Damage to the brainstem can cause loss of consciousness. The cerebellum, which is located at the base of the skull, is a curved mass of nerve tissues that regulates balance and coordinates fine motor skills. It enables us to move quickly and smoothly. Gray and white matter. The brain is made up of two types of tissue, gray matter and white matter. Gray matter is involved in analyzing information. White matter conducts information between gray matter areas. The ratio of gray to white matter changes over the lifespan. What can cause seizures? High fever in children, a brain disorder, brain injury, tumor, or stroke, poisons, electrical shock, infection of the brain or nervous system, medication, overdose, or withdrawal, reaction to vaccinations, heat illnesses, low blood sugar, hypoglycemia. Some of the symptoms of seizures: temporary confusion, a staring spell, uncontrolled jerking movement of the arms and legs, loss of awareness or consciousness. Cognitive or emotional symptoms can include fear, anxiety, or the feeling of déjà vu. There are now three major groups of seizures. The first, generalized onset seizures. These seizures affect both sides of the brain or groups of cells on both sides of the brain at the same time. This term was used before and still includes seizure types like tonic, clonic, absence, or atonic, to name a few. Second, focal onset seizures. The term focal is used instead of partial when talking about where seizures begin. Focal seizures can start in one area or group of cells in one side of the brain. Focal onset aware seizures is when a person is awake and aware during a seizure. This used to be called a simple partial seizure. Focal onset impaired awareness. This is when a person is confused or their awareness is affected in the same way during a focal seizure. This used to be called a complex partial seizure. And the third major group of seizures is unknown onset seizures. This is when the beginning of a seizure is not known, or if it is not witnessed or seen by anyone. For example, when seizures happen at night or in a person who lives alone. As more information is learned, an unknown onset seizure may later be diagnosed as a focal or generalized seizure. Many different symptoms happen during a seizure. This is a new classification that separates them simply into groups that involve movement. For generalized onset seizures, motor symptoms may include sustained rhythmical jerking movements, clonic, muscles becoming weak or limp, atonic, muscles becoming tense or rigid, tonic, brief muscle twitching, myoclonus, or epileptic spasms. The body flexes and extends repeatedly. Non-motor symptoms are usually called absence seizures. These can be typical or atypical absences. Seizures, such as staring spells, absent seizures can also have brief twitches that may affect a part of the body or just the eyelids. For focal onset seizures, motor symptoms may also include jerking, muscles becoming limp or weak, tense or rigid muscles, brief muscle twitching, or epileptic spasms. There may also be automatisms or repeated automatic movements like clapping or rubbing of hands, lip smacking or chewing, or running. Non-motor symptoms, examples of symptoms that don't affect movement, could be changes in sensation, emotions, thinking or cognition, autonomic functions, such as gastrointestinal sensation, waves of heat or cold, goosebumps, heart racing, etc., or lack of movement, called behavior arrest. For unknown onset seizures, motor seizures are described as either tonic-clonic or epileptic spasms. Non-motor seizures usually include a behavior arrest. This means that movement stops. The person may just stare or not make any other movements. Pressure ulcers, bed sores, decubitus ulcers. What is it? Injuries to skin and underlying tissue resulting from prolonged pressure on the skin. Pressure can cause serious damage to the skin and muscle when a person stays in one position in a chair for as little as an hour or in a bed for as little as 2 hours. What does it look like? The skin may be intact, but it is red or spongy, or the person complains of pain or itch in the affected area, or the skin may be open with a shallow sore. If left untreated, the ulcer can become larger and deeper and become infected and even lead to sepsis. Common sites of pressure ulcers. Where can they form? On the tailbone or buttocks, shoulder blade and spine and hip bone, the back of the head, ears, elbows, heels, and ankles. Who is at most risk for pressure ulcers? People who do not ambulate, people who are immobile, people who are wheelchair bound, people who have poor blood circulation, poor nutrition, people who are overweight or underweight, people who have thin, fragile skin, people who take lots of steroid medications, as steroids can suppress cellular response, and cause the wound to heal without proper granulation tissue. What we can do to prevent pressure ulcers. It's important to complete the risk assessment for each person in your care. To have a plan of care, create an individualized plan to prevent skin ulcers. The plan should include examination of skin thoroughly and daily, good skin hygiene, keeping the skin clean and dry, keeping skin moisturized, repositioning the person every 1 to 2 hours, if not more, good optimal hydration, making sure that people are active and mobile. Avoid dragging people across sheets or other surfaces. Use pillows to protect bony prominence, placing a pillow under the calves for floating heels over the bed or chair, and applying a skin barrier. What should we do when we see red or broken skin, or the person complains of pain in any area subject to pressure? First, we should report it immediately to the nurse or team that we work with. The person should be seen by their HCP for evaluation within 24 hours and for recommendations. Connect with the team to see if the agency has a pressure ulcer management policy. Document in detail what you see and what the person tells you using pressure ulcer guidelines. Do not put the person in a position that would further put pressure on the area, and reposition the person frequently. Thank you very much for your precious time and attention and for attending this training. John Holmes said, "There is no exercise better for the heart than reaching down and lifting people up." Steve Maraboli said, "A kind gesture can reach a wound that only compassion can heal." Thanks again.